Manual therapy, or manipulative therapy, is a physical treatment primarily used by massage therapists, physiotherapists, occupational therapists, chiropractors, osteopaths, and osteopathic physicians to treat musculoskeletal pain and disability. It most commonly includes kneading and manipulation of muscles, joint mobilization and joint manipulation. Definitions. The three most notable forms of manual therapy are manipulation, mobilization, and massage. Manipulation is the artful introduction of a rapid rotational, shear distraction force into an articulation. Manipulation is often associated with an audible popping sound caused by the instantaneous breakdown of gas bubbles that form during joint cavitation. Mobilization is a slower, more controlled process of articular and soft tissue stretching intended to improve biomechanical elasticity. Massage is typically the repetitive rubbing, stripping and kneading of myofascial tissues to principally improve interstitial fluid dynamics. The differentiation between a manipulation and mobilization from a regulatory perspective is that a mobilization can be stopped at any point should the recipient decide to forego the remainder of the procedure. On the other hand, a manipulation cannot be stopped by the practitioner once initiated. Manual therapy can be defined differently to state what is permitted within a practitioner's scope of practice. Within the physical therapy profession, manual therapy is defined as a clinical approach utilizing skilled, specific hands-on techniques, including but not limited to manipulation, mobilization, used by the physical therapist to diagnose and treat soft tissues and joint structures for the purpose of modulating pain, increasing range of motion, reducing or eliminating soft tissue inflammation, inducing relaxation, improving contractile and non-contractile tissue repair, extensibility and/or stability, facilitating movement, and improving function. A consensus study of U.S. chiropractors defined manual therapy as procedures by which the hands directly contact the body to treat the articulations and/or soft tissues. Alternatively, CORE described manual therapy as the application of an accurately determined and specifically directed manual force to the body, in order to improve mobility in areas that are restricted, in joints, in connective tissues or in skeletal muscles. Used in Western Europe, North America and Australasia, manual therapy is usually practiced by members of specific healthcare professions. However, some lay practitioners, such as bone setters, also provide some forms of manual therapy. A survey released in May 2004 by the National Center for Complementary and Integrative Health focused on who used complementary and alternative medicine, what was used, and why it was used in the United States by adults age 18 years and over during 2002. According to this recent survey, manipulative therapy was the third most commonly used NCCIH classification of CAM categories in the United States during 2002, when all use of prayer was excluded. Consistent with previous studies, this study found that the majority of individuals used CAM in conjunction with conventional medicine. Information. A number of professional peer-reviewed journals specialize in the dissemination of information associated with manual therapy. The Journal of Manual and Manipulative Therapy, Manual Therapy, and the Journal of Manipulative and Physiological Therapeutics are PubMed-indexed journals that have provided readers with useful research on manual therapy for over 15 years. Peer-reviewed information has improved the quality of information that is provided to practicing clinicians and has dispelled a number of myths commonly associated with manual therapy. Styles of manual therapy. There are many different styles of manual therapy. It is a fundamental feature of Ayurvedic medicine, traditional Chinese medicine and some forms of New Age alternative medicine, as well as being used by mainstream medical practitioners. In one form or another, it is probably as old as human culture itself and is a feature to some degree of therapeutic interactions in traditional cultures around the world.